Hey everyone, this month we're going to talk about spinal conditions. Last month we did extra spinal, we talked some knees, some shoulders. This month I want to talk neck and back pain and show you kind of what we do here differently than most traditional chiropractors based on how we treated a few of these cases. The first one I'm thinking of was, it was actually kind of a fun one because he didn't respond to any normal things we did. The tissue work we like to do, the cupping, scraping, needling, it helped relieve pain, but it didn't keep pain away. So for a couple weeks, we were working on this, and he'd come in and say, yeah, man, I leave here and I feel awesome. 2 days later, I'm right back where I was. So the tough thing was he would get immediate release and relief, and then be right back to the start. So he was having a ton of stiffness in the neck to where he couldn't turn, and he was very, very locked up. His middle and lower back were also very tight. So he's in his 50s, he does a lot of strength training, and he plays a lot of golf. And the problem was, when he was trying to enjoy those activities, he'd be in so much pain he'd have to quit. He told me he went to go play 18 with some friends and family, and he was only able to get 7 holes in before he had to quit. So what we started doing was, instead of treating the pain and treating the stiffness, we started treating the motion. So he was unable to do a lot of our normal stuff where we do a lot of joint loading. Any type of stretching or range of motion activity locked him up. It made him feel worse. So, and adjustments, again, it gave him an hour of relief, and then he'd call me and say, dude, I'm right back where I was. So we started looking at the motion, and he told me a couple things I liked. He's a golfer, so he does a lot of rotation, and he's a strength trainer. He does a lot of old school lifting, so he's used to being sore, he's used to working, so we decided to throw that in. So with him, if he's unable to extend, with most patients, we just make them extend. We work on that motion, we clear what's blocking it, and we start seeing improvement. He was different because, again, it made him worse. So as he was a golfer, I started adding rotation into his treatment. We started doing different exercises to try and access extension in his spine with rotational components. So when we have joints, right? Joints have coupled motions. So when we move, if I rotate, my bones are actually rotating, and we also get a couple additional like lateral flexion into the segments as well. So I figured with him, we were going to treat it indirectly. Again, we started doing a ton of rotational exercises, really tried to get him learning how to control that. Most people, when it comes to rotation, they don't know how to control it. They just rotate and then they stop themselves. That is what started causing injury and locking him up. So once we did a lot of exercises, rehab, a lot of controlled, slow rotational things using the belly breathing that we always preach. And in 2 sessions, he came back, he's like, this is the best I've ever felt. So again, a really cool case, something we don't see every day. It's something that was very challenging to treat, but in the end, we figured it out. And once we got the ball moving in the right direction, he cleared up within a week and he felt awesome. He's been golfing, he's been working, he's been lifting. So if this sounds like you or anyone you know, give us a call. Again, a little off the wall treatment-wise, not your typical thing we see, but it was a really rewarding case, and it was someone we were able to help.